Japan consistently ranks among the countries with high quality of life into older age. While back pain affects people everywhere, Japanese culture has maintained movement practices that many find helpful for managing discomfort and maintaining mobility. This isn't about genetics or expensive treatments. It's about 5 positions rooted in Japanese cultural practices that address common causes of back discomfort: poor posture, muscle tightness, and reduced mobility. These aren't medical treatments. They're movement patterns that may help you feel better when combined with appropriate medical care. Before we dive in, an important note: if you have chronic back pain, unexplained symptoms, or severe discomfort, please consult a healthcare provider first. These positions are complementary practices, not replacements for medical evaluation. That said, drop a comment below and tell me, how long have you been dealing with back discomfort? I read every comment and can help you figure out which movements might be worth trying first. What you're about to learn comes from traditional Japanese practices used by workers, monks, and everyday people to maintain mobility and comfort. No special equipment, no gym membership, no complicated movements. Just 5 positions that work with your body's natural design. And if you're interested in evidence-based approaches to movement and wellness, hit that subscribe button. The first movement is foundational, and it starts by completely changing how you sit. Let's talk about Seiza, which translates to proper sitting. This traditional Japanese sitting position has been used for centuries in homes, tea ceremonies, and meditation practices. Here's what many people don't realize about back discomfort. Much of it starts with pelvic position. When your pelvis tilts forward or backward from its neutral alignment, your lower back compensates. This creates stress on your lumbar spine and the surrounding muscles. And where does misalignment often come from? Hours of sitting in chairs. Modern chair sitting keeps your hip flexors, particularly the psoas and rectus femoris, in a shortened position. Over time, these muscles can become tight, pulling your pelvis forward into anterior pelvic tilt. When this happens, your lumbar spine hyperextends to keep you upright, creating compression and that familiar ache. Seiza addresses this pattern. Here's how to do it. Kneel on a comfortable surface with your knees together. Fold your feet so the tops rest flat on the ground with toes pointing backward. Slowly lower your hips until you're sitting on your heels. Your spine should be naturally tall, not forced into rigidity. What makes this position valuable is the stretch it creates in your quadriceps and hip flexors. These muscles that have been shortened from chair sitting now get lengthened. As they release, your pelvis can return toward neutral. The compression in your lower back may ease because your spine can stack more naturally. There's more happening here. Unlike passive chair sitting where postural muscles can weaken, Seiza requires gentle engagement from your core stabilizers and spinal erectors. You're stretching tight areas while activating supportive muscles. Now, if Seiza feels intense on your knees initially, that's normal. Place a firm cushion or folded towel between your heels and hips to reduce pressure. Start with just 30 seconds and gradually increase as your body adapts. The key mistake is forcing yourself into pain. This isn't about proving anything. It's about gradual adaptation. Your hip flexors may have been tight for years. They need time to change. Begin with 30 seconds to 1 minute daily. You can practice while reading or during quiet moments. Frequency matters more than duration. Many people notice they can sit longer comfortably within 2 weeks. Within a month, they often feel a shift in lower back tension. Traditional Japanese homes use Seiza as the default sitting position during meals and gatherings. People naturally spent time daily in this posture without thinking about biomechanics. It was simply how they Saturday. Seiza is your foundation, but foundation alone isn't enough. Now we need to address your thoracic spine, where compression creates upper back tension and shoulder tightness. This next movement is a standing forward fold, similar to practices used by martial artists and traditional workers. The principle is simple. Use gravity to decompress your spine. The problem this addresses is thoracic spine rigidity. Your thoracic spine, The middle section between your shoulder blades has 12 vertebrae designed to move. But modern life, especially hunching over screens, locks these vertebrae into rounded, compressed positions. When your thoracic spine can't move properly, two things happen. The spaces between vertebrae decrease, and the muscles between your shoulder blades work overtime fighting gravity. That's often where burning sensations come from. Here's how to perform this correctly. Stand with feet hip-width apart, take a deep breath, and as you exhale, hinge forward from your hips, not your waist. This distinction matters. You're folding from the hip joint while keeping your spine lengthened, not rounding from your upper back. Let your arms hang, placing hands wherever they naturally reach, shins, ankles, or floor if you're flexible. The goal isn't touching the ground. The goal is creating length in your spine while gravity gently encourages space between vertebrae. Here's what's happening. When you hinge forward with a long spine, you create axial decompression. The weight of your upper body, combined with gravity, gently encourages separation between vertebrae. This can help restore natural spacing and reduce compression. There's a secondary benefit. Your entire posterior chain, from calves to hamstrings to spinal erectors, gets a sustained stretch. These muscles are often chronically shortened from sitting and standing, creating pulling forces that compress your spine. This position releases that tension. The key mistake is rounding your spine from the upper back, creating a curve. This defeats the purpose by compressing the front of your spine more. Instead, think about lengthening as you fold, as if someone is gently pulling the crown of your head forward and down. If hamstrings are tight, bend your knees slightly. This isn't about flexibility showcasing. It's about spinal mechanics. Bent knees with a long spine is better than straight legs with a rounded back. You can also place hands on a chair to reduce the fold depth. Start by holding 20 to 30 seconds, breathing deeply. As you get comfortable, work up to 90 seconds or 2 minutes. Practice this in the morning after sleep and in the evening to address daily compression. Now that we've decompressed vertically, it's time to mobilize rotationally with a movement from meditation traditions. Here's something interesting. People who practice seated meditation often incorporate gentle twisting to maintain spinal mobility during long sitting periods. This movement is a seated twist from traditional practice. Monks discovered that prolonged stillness created stiffness in the spine. The solution was regular, gentle rotation. Let's understand what happens in your back. Your spine has numerous vertebrae with small joints called facet joints between them. These joints are designed to glide as you move, twist, and bend. But modern life doesn't require much rotation. Think about daily movements: walking forward, sitting forward, reaching forward. Almost everything happens in one plane. Your facet joints barely rotate anymore. When joints don't move through their full range regularly, they can stiffen. The lubricating fluid becomes less effective. Joint capsules tighten. Movement becomes restricted and sometimes uncomfortable. There's another factor. When you don't rotate your spine regularly, muscles on one side of your body, usually your dominant side, can become chronically tighter than the other. This creates asymmetry that can contribute to discomfort. Here's how to practice this twist. Sit on the floor cross-legged, or if that's uncomfortable, sit on the edge of a chair with feet flat. Both work equally well. Place your right hand on your left knee and your left hand on the floor behind you or on the chair back. Inhale to lengthen your spine, then exhale as you gently rotate left. Critical point. The twist initiates from your lower spine, not your shoulders. Imagine wringing out a towel from bottom to top. Your lower back rotates first, then mid-back, then upper back, and finally, your head turns to look over your left shoulder. This sequential rotation creates the beneficial effect. Here's what's happening. As you rotate, facet joints move through their range. Synovial fluid redistributes, lubricating joint surfaces. Joint capsules stretch, restoring elasticity. Meanwhile, oblique muscles on one side contract, while the opposite side stretches, creating balanced engagement. Interestingly, research suggests spinal rotation may have calming effects on the nervous system, potentially reducing muscle tension and sensitivity to discomfort. You're addressing both mechanical and neurological aspects. The common mistake is yanking yourself into the twist using arm strength. This creates tension instead of release. The twist should feel gentle, almost passive. Use breath to deepen rotation. Inhale to grow tall. Exhale to twist slightly further. Your arms guide, they don't force. Hold 15 to 30 seconds each side, breathing naturally. You might hear or feel small pops or clicks as joints mobilize. This is generally normal and often indicates restricted joints finding movement again. Perform 2 to 3 repetitions per side. Practice this during work breaks if you're in a chair, or pair it with other floor positions. Regular rotation helps maintain mobility and may prevent stiffness. Now we've addressed pelvis, spine, and rotation. But there's another critical piece: your hips. This next position addresses hip mobility, which is fundamental to spinal health. Let's talk about traditional squatting positions. In many cultures, including Japan, deep squatting has been a natural resting position for centuries. Japanese pearl divers, farmers, and craftspeople would rest in deep squats between tasks. This position does something valuable for your hips. If you've ever felt radiating discomfort from your lower back through your hip and down your leg, hip mobility might be part of the solution. Here's relevant anatomy. Deep in your hip sits a muscle called the piriformis. Near it runs the sciatic nerve, the largest nerve in your body. When your piriformis and surrounding hip muscles become tight from sitting or limited movement, they can create tension that affects the nearby nerve. The deep squat addresses this by opening your hip capsule and stretching your piriformis and related muscles in a way few other positions can. It's like releasing a valve that's been stuck. Here's how to practice. Stand with feet wider than shoulder width, toes turned out about 45 degrees. Place hands together at chest or hold something stable for balance. Slowly lower your hips toward the ground, keeping heels down if possible. Descend until hips drop below knees, or as low as comfortable. Knees should track over toes, not caving inward. Keep your chest lifted and spine long. If you can, rest elbows inside knees and gently press outward. This creates additional hip opening. Biomechanically, in this deep squat, your hip is in maximum flexion and external rotation. This combination stretches not just piriformis but also gluteus medius, gluteus minimus, and deep external rotators. All these muscles, when tight, can contribute to hip and lower back discomfort. The deep squat also creates what's called joint distraction. The ball of your hip joint pulls slightly from the socket, creating space and encouraging fluid circulation. This often provides relief from hip-related back discomfort. Interestingly, populations that regularly squat tend to maintain better hip mobility into older age compared to chair-sitting populations. It's a pattern worth considering. If you can't achieve a full deep squat, that's completely normal after years of chair sitting. Start by holding on to something sturdy for support. You can elevate heels on a small wedge or folded towel to reduce ankle demands. The key mistake is forcing heels down while compensating by rounding your lower back. If heels lift, let them. Over time, as ankle and calf flexibility improves, they'll naturally lower. Spine position matters more than heel position. Start with 20 to 30 seconds. Breathe deeply and let gravity assist. As hips open and your nervous system relaxes, work toward 1 to 2 minutes. Practice while watching something or during phone calls. For many people, this position provides noticeable relief. When you address mechanical factors affecting nerves and joints, discomfort often decreases. We've now addressed pelvis, spine, rotation, and hips. There's one final position that brings everything together. This final position is what some therapists call constructive rest. It combines traditional wisdom about restorative postures with modern understanding of nervous system regulation. Here's something valuable about recovery. Your body heals best when completely still, lying down, with zero muscular effort required. Not sleeping. because sleep positions can create their own patterns. Not sitting, because gravity still loads your spine. This specific position creates complete release. The principle: every position we've covered requires some muscular engagement. Those are beneficial, but your body also needs complete rest where every postural muscle can fully let go. Here's how to practice. Lie on your back on a firm surface like a yoga mat or carpeted floor, not your soft mattress. Bend knees and place feet flat, hip width apart. Position feet close enough that knees stay bent at roughly 90 degrees without effort. Let knees rest together for support, or keep them hip width, whatever feels more natural. Place arms at sides, palms up, or rest hands on lower belly. The key is finding where absolutely nothing is working. No muscle holding, no joint straining. Complete support from the ground. Here's what happens. First, your psoas muscle, the deep hip flexor, chronically tight from sitting, finally releases. With knees bent and supported, your psoas has no job. It can lengthen and soften, reducing pulling force on your lumbar spine. Second, your spinal structures can restore. Throughout the day, gravity compresses your spine. When you lie down with knees bent, compressive load disappears. Your body can redistribute fluid and encourage natural spacing. Third, and perhaps most profound, when you remove all muscular effort and lie completely still, your nervous system can shift from sympathetic, fight or flight mode, to parasympathetic, rest and digest mode. This triggers healing responses. Reduced stress hormones, improved tissue repair, and decreased pain sensitivity. Many people report that within 3 to 5 minutes in this position, they feel their lower back naturally settle toward the floor. This isn't something you force. It happens automatically as muscles release and your pelvis returns toward neutral. That settling is your spine finding natural alignment. If you have significant lower back curve or discomfort, place a small pillow or rolled towel under knees to reduce the bend slightly. You can put a thin pillow under your head if needed. The goal is zero effort, so modify until you find that comfortable position. The key mistake is trying to force your back flat by engaging abs. Don't. You're undoing the entire purpose. Let your body release on its own timeline. Some days it takes 2 minutes, some days 10. Your body knows what it needs. Practice for a minimum of 5 minutes, ideally 10 to 15, especially before bed. Many people become very relaxed in this position. That's the parasympathetic activation at work. When you finish, you may notice reduced stiffness. This is your reset, your daily opportunity to give your spine what it needs: complete decompression, muscular release, and nervous system calm. Now you have all 5 positions. Let me show you how to combine them into practical routines. Here's what makes these positions practical. No gym, no special equipment, minimal time, just strategic positioning at specific moments in your day. The principle: consistency matters more than intensity for managing discomfort. I'll give you 2 simple sequences, morning and evening, totaling 15 minutes. These address the specific mechanical stresses your spine faces at different times. Your morning sequence takes 5 minutes. When you wake, your body is stiff from stillness. Here's the protocol. Begin with 1 minute of Seiza to reset pelvic position and wake postural muscles. Hip flexors have been relaxed overnight, so this gentle stretch prepares them for upright activity. Move into 2 minutes of forward fold to decompress your spine and lengthen your posterior chain. This creates space before gravity compresses throughout the day. Finish with 1 minute of seated twist, 30 seconds each side, to mobilize spinal rotation and distribute fluid through facet joints. That's it. 5 minutes that can change how your back feels for hours. Your evening sequence is different, addressing accumulated tension from a full day. This takes 10 minutes and prepares you for restorative rest. Start with 2 minutes in the deep squat position. After a day of sitting or standing, hips are tight. This squat opens everything and releases pressure. You should feel relief in lower back and legs. Move into 3 minutes of Seiza. holding longer for deeper hip flexor stretch. Your psoas has been working all day. Now it gets to release. This is when you'll notice the most significant pelvic correction. Finish with 5 full minutes of constructive rest. Lie completely still. Let every muscle release. Allow your body to restore. Many people report this is when discomfort completely disappears, even if it's been present all day. Here's your progression timeline. Weeks 1 and 2 are foundation. Don't worry about duration or perfect form. Your only job is learning positions and practicing daily. Your body needs time to adapt to new patterns. Consistency matters more than anything right now. Weeks 3 and 4, start adding duration. Increase holds by 15 to 30 seconds weekly. If Seiza feels comfortable at 1 minute, try 90 seconds. If the forward fold is easy at 30 seconds, push to 45. Listen to your body while gently challenging it. Month 2 onward gets interesting. Add variations. Try gentle movements within positions, like shifting weight in the squat or adding arm movements during twists. Combine positions into flows. Increase challenge by closing eyes during certain poses, which engages your balance system more. But here's the most important principle from the Japanese concept of Kaizen: continuous small improvements. You're not competing. You're not trying to match anyone else. You're simply aiming to be stronger, more mobile, and more comfortable than last week. Some days you'll feel great and want to push harder. Other days, maintaining basic positions is perfect. Your body's feedback changes daily based on stress, sleep, activity, and numerous factors. The routine stays consistent, but intensity flexes with your needs. Track progress not by hold times, but by how your back feels during daily activities. Can you sit through a meal comfortably? Stand and cook without lower back fatigue? Wake up without stiffness? These are your real markers. These movement patterns have supported people for generations. Now you have them. Adapted for modern life and informed by current understanding of biomechanics. Remember how we started. Many cultures have maintained movement practices that support comfort and mobility into older age. That's not genetics or luck. It's consistent practice of positions that address common causes of discomfort. These 5 positions each serve a purpose. Seiza resets your pelvis. Forward fold decompresses your spine. Seated twist mobilizes rotation. Deep squat releases hips. Constructive rest gives your system complete release. These aren't medical treatments. They're movement patterns that work with your body's design. The difference between maintaining comfort and mobility versus declining into chronic discomfort often comes down to small, daily choices. 15 minutes, 5 positions. Your choice about how you move. Here's what I want you to do. Drop a comment and tell me which position you're starting with today. Trying the pelvic reset? Testing the deep squat? I read every comment and can offer specific guidance for your situation. If we hit 100 comments, I'll share the breathing techniques that can enhance these movements. Traditional practices have used specific breathing patterns to support movement for centuries. If you're interested in evidence-based approaches to movement and wellness, hit that subscribe button. We have more practical content coming, and you won't want to miss it. Remember, these practices complement, never replace, appropriate medical care. Stay well.